There are actually 6 early warning signs for breast cancer that I want to share with you. Okay, and I'm going to share some additional things of what to do about it if you happen to have breast cancer. Okay, number 1, enlargement or change of shape in one of your breasts. So if you start noticing that things are not symmetrical or there's something swollen going on, that could be an indication. Okay, number 2, palpable nodules in your breast. Now, I want to differentiate. If you start to feel a nodule close to your armpit, chances are that could be a lymph node that's swollen. Maybe you're coming down with some infection. So just because you feel a nodule doesn't at all mean it's cancer. All right, number 3, tenderness. Tenderness could be cancer, but sometimes cancer has no pain. So number 3 is very vague. It potentially could be an indicator, but not necessarily. All right, number 4, changing color. If the breast tissue is changing like this reddish color, that could be an indication. Number 5, skin changes, especially around the nipple. If it's flaky or there's some rough areas, that could indicate possibly breast cancer. All right, number 6, if there's a blood discharge coming from the nipple, that can also indicate breast cancer. Now, just because you have one or more of these does not mean you have cancer, okay? In fact, it could be something else like fibrocystic breast, which are kind of like these small little cysts that develop because you have iodine deficiency. Or it could be that the bra that you're wearing is too tight, creating redness or tenderness. Now, when we talk about breast cancer, sometimes people have a question about mammograms or thermography. What you should know about both of these diagnostic tests is they're good at picking up small masses, which is kind of considered like early detection, have not decreased the risk of dying from breast cancer. However, mammograms have actually increased the risk of doing more harm to the breast. Why? Because number 1, it compresses the breast. And number 2, they're using radiation, okay, to see the breast. The very nature of cancer originated from some trauma to your cells, specifically mitochondria, from something. And both trauma and radioactive trauma can trigger damage to your mitochondria. So if you decide to do a mammogram, you should just know this right here. The risk of harm to the breast are not insignificant. Now, what about thermography? Well, it's less traumatic and it does pick up very small little things, but it doesn't actually tell you for sure if it's cancer. Many people have been diagnosed with cancer from a mammogram and a thermography and end up getting surgery, chemo, radiation, removing the breast to find out when they really didn't have cancer. I would want to make sure I have cancer before I do anything radical. Unfortunately, there is no good test out there for early detection of cancer. Okay, you should just know that. So really, your best solution is prevention. Okay, and if you have cancer, I'm going to recommend something, but I first want to mention this other thing here. When you're told you have cancer, okay, you immediately go into a fear state. And the incidence of people dying right around when the doctor tells them they're going to die is very, very high. In other words, if the doctor says you have 3 months to live, you tend to die roughly around 3 months. Now, is that a coincidence? I don't know. How does the doctor know for sure how long you have to live? Okay, based on experience, based on past cases, what potentially could happen is you can end up worrying a healthy person, okay, and put them in fear. Fear is the absolute worst condition to be in for your health, because in that fear state, you're stuck between a rock and a hard place, okay? You don't have a solution. It's a problem without a solution that's effective. So that is a very terrible place to be in. So there's 2 situations. One is the prevention of cancer, and then the other is, let's say you have cancer, okay? What do you do about it? I'm going to put 3 very powerful videos I did on 3 success stories. 2 patients were stage 4 cancer. The other was stage 3, just borderline stage 4. And you should watch these if you have cancer, because there is something very powerful that you can do that's very effective. It's very inexpensive, called fasting. Okay. It is the most powerful antidote to cancer, but you have to do prolonged fasting. In the videos, we go through the whole thing. Okay. There's a lot of great research behind this as well. I'm not going to get into this video. I'm just telling you there is a solution if you have cancer. Now, what is the solution if you don't have cancer? Well, to actively and aggressively do things to prevent cancer. So you'd want to be in foods that create a healthy body, that don't destroy the body, that don't destroy the mitochondria. Okay, so definitely it's going to be low carbohydrate. Definitely it's going to be loaded with cruciferous vegetables. And also do whatever you can to lower your stress, because stress can also activate certain genes that could activate cancer as well. Now, the other thing about cancer is that cancer seems to spread into areas of inflammation if there's an old injury, okay? To the breast, for example, cancer tends to spread into that old injury. So this is just another reason why you should do things to create health, especially to lower inflammation in your body, everywhere in the body. If someone's a diabetic or they're pre-diabetic or they're consuming a lot of the wrong foods, they're going to have very, very high inflammatory markers. And that alone can be a trigger for cancer or something that cancer can spread into. This video is just about giving you more data to evaluate, to make better decisions. I'm not telling you which way to go, but I want to give you solutions. I also want to give you data about this right here, because sometimes you're just educated on one side of these diagnostic tests, not both sides. And I think you should know both sides. Now, since you're watching this video and you have some attention on cancer, I think it'd be very, very important for you to watch this next video on the power of fasting. Okay, check it out. I put it right here.